NHI has been in the focus. You would have found it on TV. You would have found it in all of the newspapers. You would have found it in your radio news bulletins over the past week. And it's necessary for us to make sense of it. The National Assembly has, of course, passed the contentious National Health Insurance Bill, paving the way for universal health care. Now, while the bill faced opposition from several parties, it passed 125 votes against it, 205 supporting it. And it now is a step closer to being signed into law. It's going to cover all South Africans, employed or unemployed, no matter their income. Health Minister Joe Fala said it's one of the most revolutionary bills ever passed by the House. Dr. Ntuthuko Bhengu, healthcare strategist and founder of Alchemy Health, joins us on the line for his thoughts on the passing of the bill and its implications. Welcome, Dr. Bhengu. It's good to have you.
Good morning, Clarence. Good morning to CapeTalk listeners.
A big budget government is equal to inefficiencies, incompetence, corruption. That is what our instincts have taught us, and we are worried. We are worried. Should we be?
Yes, we have to be worried. But just to state up front that universal health coverage is essential in any country that cares about its population, because healthcare at the end of the day is a right, and universal coverage speaks to everyone needing access to quality health services at the time that they need it without going bankrupt while looking for care. Now, there can never be any problem with that approach. Now, the issue is that when a country embarks on universal coverage, it has to look at its existing health sector. And in our regard, we certainly have a viable private sector that is the envy of the world, where some of our companies are actually changing how healthcare is funded and delivered all over the world. We have got hospital groups that have operated in Europe, and to then start cutting out aspects of the private sector in the originator country, a country which is South Africa, does not work well in my view. So in short, I have problems with the NHI Bill as it has been passed, and a big part of my concern has to do with the demonstrated incapacity in terms of aspects of our government and on the delivery side, and that cannot be ignored.
Yeah.
And then of course there are elements that speaks to too much power being vested in few officials, with all the risks that come with that.
So. And I think universally we're going to agree with the principle of universal healthcare. A lot like ANC policies, which cannot be faulted. It's in the implementation where they are lacking, where government is lacking. So let us understand. There's a couple of questions through as well, and I want to feature listener questions so that we can tick off all of these nigglies. How is it going to be funded? Can you explain that to us, Dr. Bhengu?
That's one of the big problems. We have not seen a funding model. Reference obviously has been made to the fact that you have about 200 billion per annum spent by the medical scheme industry, and slightly more spent in the public sector. So we all estimating that we are looking at 500 billion rand every year, which is half a trillion. It's not a small amount. Now, the issue of potentially having half a trillion rand every year concentrated under one department enterprise is of concern, and not so much in line with best practice in terms of risk management. And this is partly the reason where I differ slightly with a lot of what has been said. where people say, no, we don't need NHI. Don't start. Don't even go there. But my take is different, and I say we should definitely retain private sector, deal with the problems because it's not perfect, deal with the problems that have been identified. But again, everyone who has income must contribute to the NHI. And if after that, with the disposable income, you still want to purchase private insurance, that should be in place. Because that is essential, because one, it covers the principle of cross-subsidization. We're talking about healthcare. We're talking about health here. So those who have income should subsidize those who are not, and those who are well should subsidize those who are sick. That's just the nature of healthcare. But in basically leaving a viable private sector as well is essential to make sure that we do have aspects of our healthcare that are evidently functioning. And remember, what we saw during COVID speaks to this point. If you needed ICU beds during COVID, it didn't matter that you had medical aid or that you earned a cent. You got your ICU bed even at a private hospital. And that's the model that we don't want to lose. Because the reality as well is that when people say, no, I shouldn't pay twice. But the reality is that no country can afford all healthcare services that its population needs.
But Dr. Bhengu, we're already paying twice. Those that can pay are paying tax, and they are paying for their medical aid as well. We are now paying 3 times. Is that really what's going to happen?
It's not ideal. It's not ideal, Clarence, but I'm just saying, what option do we have? Because if you do not do that subsidization, then you don't have a country, because healthcare is critical to drive the economy. We're talking about productivity, and none of us are well if some of us are sick.
I think
it's unavoidable, but it's realistic because, Clarence, sorry, just to finish this.
Yeah.
For me, the best situation for South Africans is to get the universal coverage started, but it must be so good that we decide that, you know what, this medical scheme, I actually don't need it, and I opt out of it.
Sure. So just some questions, and I want to go to listener questions. What will happen to our savings that we have in the fund? Will it be paid out to us or transferred to the government's fund? Mary wants to know that. Can you answer that question, or is it premature?
No. This is one of the, when you say fund, you're talking about the medical scheme.
It looks like it, yes, that's the question.
No, I think this is actually one of the areas that I think government is making a fundamental mistake, because those funds belong to people who are part of those medical schemes. And remember that those funds are actually after tax in terms of people choose to pay schemes. So I don't think government has a claim on those funds, certainly not in the current dispensation.
Another question from a listener, Dr. Bhengu. One part thereof, with utter certainty, will be the withdrawal of current medical tax rebates and excess medical expenses allowances are determined by a formula. For an elderly taxpayer, will likely have... I've lost it. Somebody scrambled my message, but I'll try and find it quickly. I think it is. For an elderly taxpayer who will likely have a fair amount of the latter, I would say that the combined loss of those current deductions is approximately 20k a year. This will be used to fund the NHI, plus, without doubt, a levy to be added to pay-as-you-earn deduction monthly. The whole thing is utterly impossible financially and will cripple healthcare and encourage emigration by medical professionals. Is there any merit to that argument?
Yeah, I mean, tax credits, the sort of government always refers to those as being redirected towards the NHI. The issue is that that's nowhere near enough, even if that's done. That's nowhere near enough. But that's the basis of what we talk about when we say we don't know the model, the funding model that's in place.
Yeah.
But it can't be done without a huge tax hike. That's quite clear.
We're running out of time, and I think the critical question, and often we get, the considerations, middle-class considerations. We don't necessarily hear the considerations of the poorest of the poor. Yesterday we had rural health represented, and they flagged some benefits accruing to rural communities especially. Of NHI. They also said that the model would exclude duplicated bureaucracies in the form of MSCs and departments at provincial level, and instead allocate administrative kind of hubs across the country, making healthcare more effective. Any merits in that argument?
Yeah, the issue of having a duplication at a provincial level is an important one, and that's whether you're talking universal health coverage or not. So that's something that would work because some of the biggest problems is that we do not have aggregation of data. I mean, provinces run different systems, and all of that is not good for private sector. But the benefit, without a shadow of doubt, of universal health coverage, in theory, is possible for everybody, including the stakeholder group that you're referring to. My take-home message is that given our history of implementing huge projects, it will not help anyone if all healthcare is concentrated under one department, and when it collapses for everybody.
Yeah.
But that's the main thing.
So you'd like to see a coexistence of something in the direction of NHI with a flourishing private industry on the side as well?
You couldn't have chosen a better description, because that's exactly what universal health coverage is. It's a direction. It's not a destination. And the point is that we should start working in that direction. But also NHI is the funding component of the broader universal health coverage. So out of there is a lot that can be done infrastructurally in getting primary healthcare working. We've got ideal clinics, which are excellent.
Yes.
In terms of how they function.
Dr.
And that's
Bhengu,
that's in today's budget.
I think you've really added to this conversation. We appreciate that, but we are out of time. And I think you are flagging, and we need to understand that. You are flagging that the Big Bang approach could really compromise our health system and already our public health system that is, strained.